A month ago, Joe Sayed was living his childhood dream, flying 737s for Tiger Air, until travel restrictions cost him his job.
That kind of came as a shock, and you had to reread it a few times.
But a week later, he was on a plane to Perth for a full-time gig with the Royal Flying Doctor Service.
Weeks I was a self-isolation because of the closure of the borders. So that was it was actually pretty intense.
He's one of many commercial pilots now back in work, thanks to the service increasing its frontline capacity in response to the pandemic.
The Royal Flying Doctor Service is calling in as many staff as we can find. People are coming back from holidays. We're building up our casual rosters. We're, in some cases, having staff return to us from other organisations.
Since February, the RFDS has transported almost 300 patients with suspected or confirmed COVID-19, with extra precautions in place.
It's really important to us that we protect our operational staff from any illness whatsoever. So our base is locked down to visitors unless there's a very good reason for entering. And our non-operational staff are actually all working from home.
While it normally runs on donations, the service is currently relying on the federal government, which last week provided an extra $11 million to help with coronavirus costs.
They've also established a process to ensure that we can deliver emergency evacuations as and when they're needed, to ensure that we can take mobile respiratory clinics into communities who may need early testing.
Having first worked for the RFDS 5 years ago, Mr Sayed says he's grateful to be back.
Helping the community, knowing that you're out there doing good for the Western Australian community.
Making sure rural and remote Australians can get the care they need. Mahalia Carter, ABC News.